On the muscle strength exam, you're going to check both sides and compare side to side. We're going to do one side and then the other side. For the sake of this tape, I'm going to show you one side. But remember, you always check the other side immediately following the side that you've tested. We're going to start off with testing the supraspinatus. I'm going to have the patient bring the arm up, thumb down, slightly anterior, keep the thumb pointed down, and I want you to resist. And we use the break method of evaluation, and I want you to push down until you overpower the patient's muscle. So resist, don't let me push it down. I'm going to push until I overpower her. Good. Okay, now for the deltoid, I want your palm down, and I want you to kind of slightly bend the elbow. Resist, don't let me push it down. Good. For bicep, I'm going to have the patient bring their palm towards their shoulder. I'm going to stabilize the elbow, and I want you to pull, resist, and you overpower. Now, brachioradialis, I want you to turn the thumb towards the shoulder, stabilize, and I want you to resist. And I'm going to pull until I overpower her. Good. On the tricep, I'm going to have the thumb still pointing at the shoulder, and I'm going to have her push out slightly and give a little resistance now, as hard as you can. Good. Now on the wrist, we're going to evaluate the extensors of the wrist by having the patient bring her arm down to her lap, and I'm going to have her bring her wrist up into extension. I want her to hold it and not let me push the wrist down. I'm going to take the wrist and I'm going to push down. On wrist flexion, I'm going to have her raise the arm, flip the arm over, make a fist and come up, and don't let me push the wrist down. Good. Now on finger flexion and extension, I'm going to slide the hand back to where it's supported on the palm. And I'm going to have her extend the fingers out, and I'm going to push down on the fingers as a unit. Then I'm going to have her flip the hand over and bring the fingers up slightly, and I'm going to push down as a unit. Give me some resistance, and I'm going to extend them out. Being careful not to hyperextend the fingers. On abduction and adduction of the fingers, I'm going to have the patient spread the fingers apart. I'm going to then muscle test the index and the middle finger by bringing them together. Don't let me push the fingers together. Good. Now for adduction, I want to have the patient bring her fingers together and don't let me separate them. And I'm going to grab the fingers and separate them. Always comparing all the muscle strengths to the other side.